Today, 75 days later, we are ready. Today, there are no active cases in New Zealand. We have tested almost 40,000 people for COVID-19 in the past 17 days and none have tested positive. And so today, I can announce that Cabinet has agreed we will now move to level 1 to get our economy fully open again, and we will start almost immediately. We moved down to COVID-19 alert level 1 from midnight tonight. We are confident we have eliminated transmission of the virus in New Zealand for now, but elimination is not a point in time. It is a sustained effort. We almost certainly will see cases here again. And I do want to say that again. We will almost certainly see cases here again. And that is not a sign that we have failed. It is a reality of this virus. But if and when that occurs, we have to make sure, and we are, that we are prepared.
It pains me to say this, but it really was an unmitigated disaster, what the Trump administration has done. And of course, for months they've been saying this is not a problem.
A lot of people think that goes away in April with the heat.
We've got the virus under control.
At this moment, we think we have it very much in hand.
We're not going to see very many cases.
15 people. Out of billions of people, 15 people.
It's no worse than the flu.
That's a little bit like the flu. It's a little like the regular flu.
Those are all the wrong messages. Don't minimize the disease. Let's not turn this into a political fight between Democrats and Republicans. The coronavirus doesn't care if you're a Democrat or a Republican. It's going to infect you just the same. But the bottom line is that we have to treat coronavirus seriously. When you're downplaying a risk, you don't put a lot of effort into figuring out how big a problem it is. We have fallen behind most other countries in terms of testing people. Every country from South Korea to Japan to Italy, England, France, Germany, they're all doing a much better job of testing people. We just haven't developed the tests. If you get symptoms of coronavirus tomorrow, it's very hard for you to get tested for the infection because we just don't have the tests. I think it's basically because our leaders, they just haven't put the attention that you need to get these tests developed. I'm not a partisan. My feeling is, as a public health person, when our political leaders drop the ball, whether they're on the left or the right, it's up to people like us to call them out on it. If we do nothing, we're on the same path as Italy, and we're going to be there in 2 weeks. In Italy, you had people getting turned away who were critically ill because they just didn't have beds. They didn't have enough doctors and nurses to care for those people. We are definitely on the same trajectory as Italy, but we don't have to have the same fate as Italy. I think we have to focus on now is what do we do moving forward? And that's where I think we need urgent action. And I think there's a lot we can do as a community, as a country, to get through the next phase. And that's why we're implementing all these social distancing measures, like canceling sporting events and concerts and shutting down schools. If we don't do anything, if we just go back our daily business, go to concerts, go work, go to school, do everything the way we were doing 6 months ago, we're likely going to see a big spike in cases. And what's going to happen is that the number of people who get very, very sick is going to totally overwhelm the healthcare system. And the healthcare system is not going to be able to take care of everybody. The whole idea of spreading the risk, spreading the disease is that by doing these social distancing things, you slow down the rate by which the infection spreads in the community. We may still end up with the same number of people getting infected, but instead of it all happening over a month, if it happens over 6 months or 9 months, then hospitals are going to be able to accommodate all of those people because at any given moment, they're not going to get overwhelmed. And so the name of the game now is making sure we spread the infections out over time so our doctors and our nurses and our hospitals can care for everybody who needs to be cared for. And we have to act together as a single people, as Americans, and really as citizens across the world. We have to work together to defeat this virus.